I practiced for about 12 years now,
Okay.
and so I certainly saw the benefits of myself. Yeah, so that's an interesting question because actually there's not very much has been done so far, which was really strange to me as a person working in rehab, and meditation is a cognitive skill, and so it seemed to me that it would be pretty easy to make the translation between this cognitive training, cognitive skill, and people who have cognitive impairment because of, for example, traumatic brain injury. But actually there's been not too much has been done so far. The field is starting to look at it more closely, but actually I feel that some of the work that I'm doing is some of the early work. There's a pretty large body of literature that looks at it in other clinical populations, so a lot on depression, anxiety, mood disorders, that type of thing, but less with people with cognitive impairment. So the actual technique, if you take mindfulness, so someone is focusing on their breathing and their mind is wandering and then they come back to their breathing. Mm-hmm. So they're focusing on the present moment and then they get distracted and then they come back. So that, if you think about conflict monitoring in terms of substrates of attention, so that's exactly what that process is. You're being pulled by something in the environment and then you come back. And that's actually what the studies tend to show, is conflict monitoring is one of the first things that improves when you practice mindfulness. And then over time people become less distractible and then they can let their focus be a lot broader without being distracted by things, so that would be a different substrate of attention. And then the thing that we're really trying to figure out in our lab is how that relates to emotion regulation. So people seem to be able to improve their emotion regulation capabilities over time, but we still don't really understand the neural substrate of that. So I have some ideas about how that relates to attention. Yeah. So that's what we hope to uncover, especially in things like our fMRI work. The first studies on that really started to come out in 2005, so a landmark study by Sarah Lazar and our colleagues at Harvard was one of the first studies to show structural plasticity from the effects of meditation, mindfulness. And what they found was people who'd been practicing for a long time had decreased cortical atrophy. So we know as we get older our brain shrinks. The people who were meditating for a long time had a lower rate of shrinkage, and especially as people got older this was even more pronounced. So that has obvious implications for aging. And the part of the brain that was most strongly affected was dorsolateral prefrontal cortex, which we know is very important in attentional control and self-regulation. So that was really the hallmark first study, and now there's been several studies have come out since then. In fact, one that's in press right now that's actually looking at people who just went through the 8-week MBSR training. Already they can detect changes in DLPFC and also the hippocampus. So even with just 8 weeks of training, they've started to show some plastic changes. And then also there's a lot of evidence about functional neuroplasticity, so in terms of changes that are evidenced on fMRI or PET scans. This is very new, so there's maybe just, 3 or 4 studies other than the work that we've done that have looked at traumatic brain injury. And actually those people focused on psychological outcomes like depression and quality of life. So we're, I think, one of the first, or maybe the first, to look at brain injury from a cognitive perspective. Lately there's been a lot of interest in mindfulness with ADHD, so there's actually like a paper by Lydia Zalowska in 2007 that looked at adolescents and adults with ADHD, and they found improved attentional control, so executive attention, and also psychological changes. So there's a lot of interest, I think, in ADHD. Okay. But yeah, as I said, it's still a very new field. I think people are just starting to catch on to the fact that this is applicable. Because I think people have questioned, well, it's a cognitively demanding skill. Can we really teach this to people who are brain injured? Yes, for sure. But I think now we have some preliminary evidence that yes, we really can. In the next year we're going to be starting a study with at-risk older adults, so people who are not quite diagnosed with Alzheimer's but have something called mild cognitive impairment, or maybe even slightly before that. So they're at risk for some cognitive decline, so the idea is if we can get them and institute this type of training as a preventative measure to maybe slow the rate of decline, which builds off these neuroplasticity papers. It shows that meditation decreases the rate of brain shrinkage. So that's some work that one population we're going to start working with probably in the next year. Yeah, so mindfulness-based stress reduction, that's MBSR. So it's a manualised programme that's been around since about 1970. And it teaches people different mindfulness skills and skills in daily life. And it's an 8-week programme, and people practice meditation every day, ideally. And there's some cognitive behavioural techniques they learn along the way. So when we implemented our trial using this with people with mild TBI, we've made some modifications because we realised that people with cognitive impairment probably can't do the treatment as it is. So for example, they have memory impairments. So some of the techniques we had to repeat many times to make sure they actually learned the information.
Yeah.
We would have to make the sessions a bit shorter because people with TBI sometimes have difficulties with fatigue or endurance, that type of thing. And then in terms of the actual effects, so when we think about neurorehabilitation, we can think about actually improving a person's skill level. So for example, you can train someone's attention and it can actually improve, or you teach them how to compensate to kind of backdoor and get around the problem. And also some of that is emotional adjustment. So it was actually some of both that we found in the MBSR training. So people with mild TBI actually did improve their attention, so their sustained attention, able to focus over a long time, and also mental control or complex attention seemed to get better. But also they had a better quality of life. They said they felt better about their life, and also self-efficacy. So far we've been doing computerized and paper and pencil cognitive tests, so focusing on attention, self-report measures of emotion. And this summer we're going to be starting 2 new studies that use ERP, event-related potentials using EEG technology, and also fMRI. So we are going to be starting that this summer. The 2 areas of the field are kind of split because there's the people who look at healthy practitioners who tend to use fMRI, PET scans and so on, and then the clinical people tend to do a lot more self-report or paper and pencil tests. So we're trying to actually bring those 2 together by using multiple methodologies. So often, for example, when we were doing our MBSR group, we would get referrals from the other therapists. So the speech therapist or the occupational therapist would say, you know, this person's having some difficulties in attention and emotional control, and you know, they seem very open to the idea of learning meditation, so we'd like to refer them to the group. And then also the patient would go back to working with the individual therapist, and they would kind of reinforce, you know, have you been doing your meditation practice today? And so there was definitely a sense of when someone has a team, everyone is working towards the same goal. So everyone is on the same page about what the patient is trying to work towards. So yeah, so at our team we had, you know, the neuropsychologist was usually the primary person on the team, and then we'd have speech therapy, physical therapy, occupational therapy, vocational therapy, there was a counsellor, so a lot of people working together. So I think one part of it that's encouraging is this is probably a fairly cost-effective treatment. I mean, traditional neurorehabilitation, especially holistic rehabilitation, which involves multiple modalities, is very expensive and very time-intensive. We were able to show some positive changes in just an 8-week group, and it was much less labour and cost intensive. So, you know, with the insurance the way it is now, that's an encouraging finding that it's cost effective. The flip side to that is, though, people have to be really trained to be able to do this work. Yes. So you can't just walk in and do this training, and actually it's really recommended, and I agree with this, that people who are teaching these programs also meditate themselves, because that's how you understand when the patient brings some problem back to you, you figure out how to solve it because you've had a similar problem when you meditate. So that's a really important part of it. So it does take some time and money just to do the initial training. Well, this is an excellent question actually that we are trying to look at in the study we're doing right now. So in medicine they talk about the dose-response relationship. So for example, how much of a cholesterol medication do you need to take to reduce your risk of high cholesterol? So there's actually not a lot of information right now on what the dose-response relationship is for meditation. So we are, what we've been doing in the current study is we have people keep a log where every day they write down how many minutes they meditated, and then we're going to associate that with the changes in cognitive and emotional functioning. So you can actually use minutes of meditation to predict how far they change.